Not everyone in healthcare needs their own malpractice policy, but here's who absolutely does and who can share coverage. Most people assume that if you work in healthcare, you have to carry your own malpractice insurance, but that's not always the case. Here's how it actually works. Physicians and surgeons should always carry their own malpractice insurance. This means that it's their name on the policy declaration page, and they have their own individual set of malpractice limits that are uniquely for them. Corporations and medical entities also need to be covered for medical malpractice, but they can be covered one of two ways. They can either have their own individual policy with a separate set of limits, or in the case of a solo provider, they can share coverage with the first named insured doctor. APPs like physician assistants, nurse practitioners, or CRNAs can typically be covered underneath a corporation's medical malpractice policy, but not always. It does depend on what state you practice in. But many APPs still prefer to carry their own individual medical malpractice insurance for personal protection and portability. Allied health staff, such as medical assistants, registered nurses, estheticians, or even front office support, typically does not need to carry their own individual medical malpractice insurance. They can either be covered underneath the practice policy or underneath the physician. So if you're wondering if your current setup is giving you the protection that you need, let's take a look. Message us for help today.